I think it's very important to understand if it's suitable for you, because a lot of people develop mouth ulcers as well when they take certain green teas. So you have to first see, is it really suitable for you. I would suggest you start with 1 cup a day. I think is good enough. And then if you feel comfortable with it, I think maximum two cup of teas in a day. I wouldn't recommend anything more than that, although there is no established evidence in terms of how much is sufficient or how much will cause any other challenges or issues. Yeah. So you can have any high protein and high fiber meal as a part of your pre-workout meal plan for a diabetic patient. Make sure that it has a low glycemic index, so that is important. So some options could be in terms of and also to get little bit good calories. So banana is a good option that they can have it as a part of pre-workout meal. Eggs, if they're vegetarian, they can have eggs. And you have to combine a high protein, high fiber food sometime, because you may not get it in the same food. So you can have maybe a banana and egg together. So that could be another one. Yeah, and if you're open to having foods which are ready-made, then there are a lot of options in terms of oatmeals, which is available in the market easily, or they can also take supplements which are rich in protein and fiber. So any fat, we have to take it in proportion. Any fat in excess is a bad fat. But definitely trans fat, I would rank it as number one that you should avoid. Even the international guidelines talk about restricting the trans fat intake food. We should not take more than 10% of our daily calories from saturated fat. So you have to also limit saturated fat to an extent. Polyunsaturated fatty acids are comparatively, and monounsaturated fatty acids are comparatively better. But again, like I said, you have to take it in moderation. So I think that recommendation has come in the light of you should not use artificial sweeteners for weight management. Means using those to a certain extent is okay, but you should not use them as part of recipes. A diabetic patient will need sweetener in certain small amounts, at least for tea or coffee, So, and there are established ADR for each of the sweetener that has already been established by WHO as well, and it has already been previously established by FDA, US FDA. So we can follow those, and I think it would be okay.